Welcome to Dr. Esmanak Medici classes. In today's class, let us learn about insulin resistance. Before understanding what is insulin resistance, first let us understand what is insulin and what are the functions of insulin in the body. So, insulin is a polypeptide hormone which is synthesized from the beta cells of the pancreas of human beings. The first basic function of insulin is it controls glucose levels from the blood, because in hyperglycemic conditions, in the patients who increased the glucose levels in the blood, these increased glucose levels will be reduced by insulin. So this is the primary function of insulin, everyone knows. But let me ask you one question: is insulin a anabolic hormone or a catabolic hormone? How insulin is causing catabolic reaction? Insulin goes and binds on the insulin receptor, and by binding on the insulin receptor, the glucose transporters will attach on the cell membrane, and by that, through the glucose transporters, the glucose which is present in the blood enters into the cell, and by entering into the cell, it starts metabolism, or it breaks down the glucose into carbon dioxide and water, and it produces energy molecules. So this is the catabolic reaction, indirect catabolic reaction of insulin on carbohydrate metabolism. Predominantly insulin is a anabolic hormone. Because why I am telling? Because it has three major functions. It contributes in synthesis of glycogen, and it helps in the production of proteins, and it is also very important in production of fats from the excess amount of glucose in the blood. One thing, whenever a patient has increased glucose levels, 50% of glucose will enter into the cells by insulin, and the remaining 50% of the glucose is transported into the liver or in the tissues. It converts this glucose into glycogen. 40% of the glucose is converted into glycogen, it will be stored, and remaining 10% is converted into fats, and it will be stored in the tissues. So this is anabolic reaction. Okay, and finally it is also helpful in production of some proteins and amino acids. So because of the production of glycogen, production of lipids, and it is also helpful in production of amino acids, insulin is considered as anabolic hormone. Okay, now let's go back to insulin resistance. And about insulin and diabetes mellitus, there are many concepts to be discussed, but still in this lecture I'll not drag, but I'll just tell you what is insulin resistance. Insulin resistance is nothing but there are some cases where excess amount of insulin should be produced to act on the insulin receptors. So in some cases there are 100 units of insulin is produced per day, and in some cases 200 units of insulin should be produced to show its activity. Despite insulin, usually in a normal patient 50 to 60 units of insulin is produced per day. 60 is also a high amount, but typically if we consider a patient's body weight as 70, so roughly 30 to 36 units of insulin per day is the insulin daily dose, insulin daily requirement for the body, for typically 70 kgs body weight patient. But in some cases insulin concentration or production of insulin rises to 100 to 200 units per day, and this condition where excess amount of insulin is required is considered as insulin resistance. So insulin resistance is categorized into two types. One is acute form of insulin resistance, and the other one is chronic form of insulin resistance. So acute form of insulin resistance is usually caused by some factors. One is, most of the time in infection condition patient may have insulin resistance. Infection is one reason, and sometimes trauma, surgery cases, and overuse of corticosteroids. Ketoacidosis is another condition, and sometimes emotional stress is also another cause for insulin resistance. So these are some causes which may lead to insulin resistance. And if we see the chronic form of insulin resistance, there are many factors which induce insulin resistance. In that, the first factor is use of conventional form of insulin formulations. For example, we have bovine insulin, which is synthesized from beef, and we have porcine insulin, which is synthesized from pork. Okay, so these are conventional forms. However, nowadays we are not using these conventional forms of insulin, and we are using the most purified is synthesized by RDNA technology from human beings. So most purified insulins will have less they'll cause less affinity to produce insulin resistance. Okay, so when we use conventional forms of insulin, that will have some contamination in the insulins, and due to the contaminated insulins, or sometimes these conventional forms of insulins may contain some antigens which will induce production of antibodies in the human beings, and that may lead to insulin resistance. So in that cases, switching of conventional form of insulin to the most purified form is the main treatment of choice, and in some cases excess amount of insulin, purified insulin, is given to reduce insulin resistance. And there is another case, pregnancy and use of oral contraceptives is also a reason for chronic insulin resistance, and sometimes Cushing's disease. Cushing's disease is one cause for insulin resistance. Lipoatropic diabetes mellitus is another genetic cause which causes insulin resistance. Lipoatropic diabetes mellitus is a genetic disorder which is mainly characterized by insulin resistance, and which is usually characterized by a reduced amount of fat deposition in the body, or a reduced amount of adipose tissue in the body. And sometimes hypertension is also which may induce insulin resistance sometimes. So these are some functions, these are some factors which causes insulin resistance. Now let us see how insulin resistance is reduced in the patient. One thing everyone should understand, that insulin resistance is usually caused due to increased amount of calorie intake, and it is also caused due to reduced physical activities done by the patient. So to treat the patient with insulin resistance, one thing we have to do is to reduce intake of excess amount of calories. So diet management is very important step, first step. And second one is to induce the patient to do some physical activities. So when a person does excess amount of physical activities, the cells which are dependent on insulin will increase insulin activity, and by that insulin resistance will be reduced. And third case, excess amount of purified insulin administration is the third option by which we can reduce insulin resistance in the patient. So that's it for today. This is about brief concept about insulin and insulin resistance. Thanks for watching. We'll meet in the next class. Thank you all.